Hi all, I'm Dr. Malati, working as a professor in Triple College of Nursing. So in this video, I'm going to discuss about the HPV vaccine. The objectives are introduction, HPV, types of HPV, epidemiology, transmission, diagnosis, signs and symptoms, HPV vaccine, nurse's role, summary and conclusion. Introduction. HPV vaccine is an important preventive measure used to protect the individuals against the infections caused by human papilloma virus. HPV is a commonly sexually transmitted virus. It is associated with various cancer, especially cervical cancer as well as the genital warts and other anogenital and oropharyngeal cancer. HPV vaccine is a safe and effective immunization that helps the body to develop the immunity against the most high-risk HPV types, which is responsible for the majority of cervical cancer. It is also recommended primarily for adolescents and young adults, ideally before the onset of the sexual activity, but can also be given later for protection. For nursing students, understanding the HPV vaccine is essential as it plays a crucial role in preventive healthcare, health education, and community awareness program aimed at reducing the burden of HPV-related diseases. Nurses are also responsible for vaccine administration, patient counseling, and promoting adherence to immunization schedule. HPV. So before stepping inside the HPV vaccine, I would like to share some important points regarding the HPV types, signs and symptoms, diagnosis, what is the epidemiology rate in India. So HPV infection is considered as a main causative agent in cervical cancer. So it is proved that 100% of squamous cervical cancer contain HPV only. So genital warts, it will develop both in men as well as in the women as a result of infection, HPV. Sometimes they can be passed on to children during childbirth through the infected vagina. So HPV can also cause warts in other parts of the body such as inside the mouth and upper respiratory tract also. Later it occurs as a rare condition called recurrent respiratory papillomatosis. Types of HPV. HPV types are HPV 16, 18, 31, 33 and 35. It also causes the genital warts, but the presence of HPV 6 or 11 causes 90% of the genital warts. So how this genital warts will be? It is very flat, fleshy, large or small bumps that grow in or near the genital area. Sometimes they may appear in the dense cluster looking like a cauliflower. They may also located on the vagina, vulva, penis, anus, scrotum, cervix, urethra and groins or the uppermost part of the thigh. So these are the areas where there is a chances of getting a genital warts. Epidemiology. Worldwide cervical cancer is 12th most common and 5th most deadly cancer in women. So it affects about 16 per 1 lakh population women per year and kills about 9 per 1 lakh population each year. Approximately 80% of cervical cancer in developing countries. This is burden of cervical cancer in India. Around 67,477 deaths are happening annually. Approximately 185 women die every day. Approximately 8 women die every hour and every 8 minutes a woman dies. Transmission of HPV. HPV is commonly transmitted between humans through their skin or moist membrane linings such as vagina, anus, mouth or throat. A patient with genital warts can also spread the infection to another area on the body. Thus, hand contact or contact with the infected organ may pass the HPV virus or from one place to another place and from one person to another person. So warts can also develop inside the mouth, but this is not very common. Genital warts do not spread through the use of shared items such as cups, towels and plates. So the presence of infection requires that the patient adopt safe sexual behavior to avoid the spreading of infection to the sexual partners. Patients may also experience discomfort or itching. So these warts may also become inflamed and bleed. Sometimes warts in the urethra can also alter the flow of urine also. So the occurrence of genital warts is not associated with the higher risk of a cervical cancer. So these are the percentage of each area which is the HPV vaccine get affected. So cervical cancer 100% is there. Vaginal cancer 70%, vulvar cancer it is 43%, genital warts 100%, anal cancer 88%, oropharyngeal cancer 13 to 56%, penile cancer is 50%. So HPV infection is the cause of cervical cancer and is linked to several other anogenital diseases also. Diagnosis. So we can able to diagnose this through the physical examination based on the signs and symptoms. Then every 5 years the woman has to undergo the pap smear test, and after conforming with the pap smear we can make a woman to undergo the colposcopy. So through colposcopy we can able to visualize the inner genital areas. So this is the instrument colposcope where we can able to visualize. Signs and symptoms are, in the early stages actually there is no signs and symptoms at all, but later once it has progressed, vaginal bleeding at unusual time. So bleeding outside the period of menstruation for women of childbearing age and at any time after women have been through the menopause. Pain and discomfort during sex, unusual smelling, vaginal discharge, constipation, fatigue, blood in urine, incontinence, swelling of one leg, kidney pain in the side or back, weight loss, bone pain, and loss of appetite. These are the signs and symptoms. HPV vaccine. So HPV vaccine protects against the infection with the human papilloma virus. So there are 3 vaccines that prevents the infections. The disease causing HPV has been licensed in the USA. Gardasil, Gardasil 9 and Cervarix. These are the 3 vaccines. So since 2016, Gardasil 9 is the only vaccine available in the United States of America. It prevents the infection with the following 9 HPV types. HPV type 6 and 11, which causes 90% of the genital warts, as I have discussed this earlier. So HPV type 16 and 18, then 2 high-risk HPV that cause about 70% of cervical cancer and an even higher percentage of some of the other HPV caused cancer. HPV types like 31, 33, 45, 52 and 58 are considered as a high-risk HPV that account for an additional 10% to 20% of the cervical cancer. So, Cervarix prevents the infection with type 16 and 18 and Gardasil prevent the infection with type 6, 11, 16 and 18. Both the vaccine are still used in some other countries also. So usually vaccination can be started at any age of 9 to 26 years. Some people who are vaccinated may develop the side effects such as headache, dizziness, stomach pain, diarrhea, soreness, aching muscles and pain or redness at injection site. Vaccinated people will not get HPV from the HPV vaccine. The vaccine is made from inactivated virus particles or pieces of virus that cannot cause infection. So it is designed to stimulate an immune system to protect against certain strains of HPV, but it does not contain live virus. So HPV vaccine, it does not lead to an increase in risky sexual behavior in teens. The vaccine is an important tool in preventing the HPV related cancer and diseases, and it does not cause infertility also. The vaccine is most effective when given before the onset of sexual activity, but still it can provide the protection against the strains of HPV that a person may not have been exposed to it. Even if someone is already sexually active also get vaccinated, it will reduce the risk of HPV related cancer and diseases. but comparatively is lesser than the people who are sexually active, which means the people those who are receiving the vaccine before they are sexually active will have more percentage than the person who is sexually active. So the HPV vaccine is generally recommended for the people up to the age of 26 years. However, individuals aged between 27 to 45 may still benefit, they will get the benefit from vaccination, especially if they are at risk for new HPV infections. The HPV vaccine does not eliminate the need for regular cervical cancer screening. So, if a person is receiving HPV vaccine also, they are supposed to undergo this screening process, the pap smear. While the vaccine is highly effective at preventive infections from the most common cancer causing strains of the HPV, it does not protect against all type of HPV or prevent all potential causes of cervical cancer. So if the person receives HPV also, it will not protect all the 9 types of HPV. Okay. So HPV vaccine, it is a primary prevention vaccination. So in the secondary prevention, we can do the screening and treatment of precancerous. So after the secondary prevention, if they have ruled out that the woman is suffering from cervical cancer, means we are supposed to start with the cancer treatment either through the medical management or the surgical management, and finally palliative care. Vaccine profile. So there are two types of products is available: quadrivalent vaccine and bivalent. Quadrivalent is for HPV 6, 11, 16 and 18, and bivalent is for 16 and 18. The manufacturer for quadrivalent is USA FDA approved, it is Merck, and for the bivalent, GlaxoSmithKline bivalent vaccine. So the indications are the prevention of HPV 6, 11, 16 and 18, which is related to cervical cancer, adenocarcinoma, vulval and vaginal cancer, anogenital warts, recurrent respiratory papillomatosis. For the bivalent, prevention of HPV 16, 18 related cervical cancer, adenocarcinoma. Then age for receiving the quadrivalent is 9 to 45, whereas bivalent is 10 to 45. So tolerability is both the vaccine are well tolerated. The product of this quadrivalent, the efficacy in 16 to 26 years women is 98 to 100% as per the phase 3 future trials. For bivalent, 91% efficacy as per the phase 3 Patricia trial of GSK. So the efficacy in adult women, that is more than 26 years, it is proven with future 3 trials with 91% efficacy. Whereas in bivalent, efficacy studies are not done, only immunobridging studies are carrying out. Immune memory at 6 years, it is proven here in the quadrivalent. For the bivalent, it is not yet done. Cross protection, it is proven against 10 serotypes other than the vaccine serotypes in quadrivalent. Here in the bivalent, it is proven against 4 serotypes other than the vaccine serotypes. Who has to receive the vaccine? So most countries, they are recommending this kind of vaccination for girls and boys in the primary age group between 9 to 12 years. So catch-up vaccination we can give till 45 years for both the vaccines. So some countries, they will recommend the quadrivalent vaccination in males also. So current HPV vaccine in India, if you see, the girls are vaccinated only less than 1%. It is based on the National Family Health Survey 2019-21. So the challenges in HPV vaccine, if you see, the women are feeling that this vaccine is very high, expensive, and multiple doses we are supposed to receive. Shortage of vaccine is there, and it also not included in the vaccination schedule. So there is a barrier to take a HPV vaccine. And HPV vaccine is very safe, highly effective. It covers 93 to 100% in preventing the cervical precancer and cancer. Recommended HPV vaccine for adolescent as per the WHO. That is on time, ideal time. If you see, it is between the age group of 11 to 12 years. 2 doses they are supposed to take. But starting is, we can start at the age of 9 years itself. That is between 9 to 10 years, 2 doses. Ideal time is between 11 to 12 years, 2 doses. Late age group is 13 to 14 years, 2 doses. And between 15 to 26 years means we are supposed to take 3 doses. So dosage and administration. So the vaccine should be shaken well before administering. The dose is 0.5 ml IM in the deltoid muscle or else in the upper anterior thigh we are supposed to give. Recommended schedule is 3-dose schedule is 026 for quadrivalent and 016 for bivalent. So minimum dose interval, if you see, for the first and second dose it should be 4 weeks interval, and for the second and third dose it should be 12 weeks interval. Does HPV vaccine available at free of cost? Yes. HPV vaccine is available for free in some countries, including Italy. Since 2007 to 8, girls have been offered the HPV vaccine for free when they turn 11 years old itself. In Germany, the HPV vaccine is free for the recommended age group. In Finland, Cervarix vaccine is free for girls and for boys between the age of 10 and 12 as part of their national vaccination program. In Indian government, it has taken the steps to make these vaccines are more accessible in states such as Punjab, Sikkim, Karnataka, Tamil Nadu, Chhattisgarh, Maharashtra. They have announced free HPV vaccination programs for school girls in specific districts as part of pilot projects. Is the HPV vaccine effective after someone has been exposed to the virus? HPV vaccine is most effective when given before someone is exposed to the virus. If a person has already been exposed to HPV means the vaccine may still provide some benefits, but it will not cover the full aspects. It won't treat existing infections or diseases caused by the other viruses. It can also help to protect against other strains of HPV that the person has not been exposed to. HPV vaccine protects all type of HPV. The HPV vaccine does not protect against all types of HPV, but it does cover the most common and high-risk strains associated with cervical cancer and other HPV-related cancer. So I told you earlier there are 3 main vaccines available: Gardasil, Gardasil 9 and Cervarix. Gardasil, it protects against 4 types: 6, 11, 16 and 18. Gardasil 9 protects against 9 types: 6, 11, 16, 18 and 5 additional high risk types like 31, 33, 45, 52 and 58. Cervarix protects against 2 high risk types like 16 and 18. While the vaccine significantly reduces the risk of infection with the types it covers, it is still possible to contract other strains of HPV not included in the vaccine. So regular screening like pap test are still important for the cervical cancer prevention. HPV vaccine can be taken along with other vaccine. Yes, HPV vaccine can be taken at the same time as other vaccine. So health authorities, including the Centers for Disease Control and Prevention, states that the HPV vaccine can be administered during the same visit as other vaccine, such as the meningococcal and Tdap vaccine, without any issues. This can be particularly beneficial for pre-teens and teens, as it helps ensure they receive all recommended vaccinations in a timely manner. If you have any specific concerns about vaccination schedule, it is also a good idea to consult with the healthcare provider. Now, coming on to the nursing role in HPV vaccine. So here the nurses plays a key role in prevention of diseases caused by HPV, including the cervical cancer. So their responsibilities extend from education to follow-up care. First and foremost is health education and awareness. Nurses can educate the adolescent, parents, and community about HPV, its transmission and complications, can explain the benefits, safety, and importance of yearly vaccination, address the myths, fears, and cultural concerns regarding the vaccine. Second component is screening and assessment. Identify the eligible individuals based on age and vaccination guidelines. Assess the medical history, allergy, and contraindication. Ensure the informed consent before the vaccination. Vaccine administration, follow the proper dose, schedule, and route of administration. Maintain the aseptic technique and safe injection practices. Ensure the correct storage and handling of vaccine. That is cold chain maintenance method. Next aspect is counseling and communication. Provide pre and post vaccination counseling. Inform about the possible side effects and their management. Encourage the completion of the full vaccination schedule. Next aspect is monitoring and management. Observe for immediate adverse reaction after vaccination. Manage the minor side effects and report the serious adverse events. Maintain the emergency readiness for anaphylaxis. Next component is documentation and record keeping. So record the vaccine detail, dose, batch number, date, and site. Maintain the immunization records accurately. Ensure the follow-up and reminder system for subsequent doses. Next component is community outreach and advocacy. Participate in school health programs and immunization campaigns. Promote HPV vaccination as part of preventive healthcare. Collaborate with healthcare teams to improve the vaccine coverage. Summary: the HPV vaccine is an effective preventive measure against infections caused by HPV, which is a major cause of cervical cancer and other malignancies. It is most beneficial when administered before exposure to the virus, particularly in adolescents. The vaccine is safe, immunogenic, and also plays a key role in reducing the incidence of HPV-related diseases. Nurses play an essential role in vaccine delivery, education, and promoting the public awareness. Conclusion: HPV vaccination is a vital strategy in the prevention of cervical cancer and other HPV associated conditions. Increasing awareness, ensuring timely vaccination, and strengthening the immunization programs can significantly reduce the disease burden. Nurses, as frontline healthcare providers, have a critical responsibility in advocating for HPV vaccination and improving the community health outcomes. References. Thank you.